Ethical Principles in Nursing, Case Scenario Review. Introduction. A physician's defining task is to make judgments on patient care in various circumstances. These choices entail more than identifying the most suitable therapy or strategy. Ethics is an essential and indispensable aspect of clinical medicine, as doctors and nurses have an ethical commitment to benefit the patient, prevent or limit damage, and respect the patient's beliefs and choices. The ethical values that nurses must adhere to include justice, accountability, beneficence, nonmaleficence, loyalty, autonomy, and veracity. Fairness is the foundation of justice. Thus, nurses must be fair while distributing care, for example, among patients in a group of clients for whom they care. A nurse must remain current on the most recent patient care developments. In addition, they must monitor the patient's therapy and care and report any concerns or results to the patient's physician or other healthcare professionals. Nursing law is a collection of norms that regulate nurses' conduct. It is enforceable, relates to all nursing staff, and mandates attaining a specified level. Violation of ethical or legal standards in the scenario. In this situation, the nurse violated the principle of beneficence. The concept of beneficence is the responsibility of the practitioner to act for the patient's health benefit. It promotes various moral standards to safeguard and defend the rights of others and avoid injury. Regarding medical choices, individuals and their families must always take priority. Notwithstanding this, there is considerable doubt over whether patient-beneficial practices exist. In the scenario, the nurse cares more about his own family than the needs of the patient in need. Risk of any civil or criminal liability in the scenario. The legislation requires nursing licensing boards to ensure that their members are qualified. These organizations provide fundamental guidelines for practice, morals, and professional behavior. A formal complaint may be submitted to the nursing licensing body if these requirements are not satisfied. Complaints may concern any area of nursing, including prescription errors, breach of confidentiality, unlicensed practice of medicine, and patient abuse, to name a few instances. In the scenario, it is uncertain that the nurse would face criminal charges. This is attributable to the fact that criminal liability is more suitable in situations such as if a nurse is believed to have engaged in unlawful behavior, the regulators may be contacted. Criminal allegations against nurses include criminal negligence, sexual misconduct, and bodily harm, to name a few. Ethical or legal responsibility of the nurse in the scenario. The nurse had a moral duty to care for the victim in dire need of medical assistance. The provision of necessary care to people in need is among nurses' most important ethical obligations. This means being accessible to clients when they need help and attentive to their needs, not just their illnesses. It also requires being truthful and open about one's limits and obligations as a nurse and not disregarding or ignoring the patient's demands. If a nurse takes the time to comprehend their patient's circumstances and needs thoroughly, they will be capable of providing care of the highest quality. There is a significant difference between legal and moral responsibilities. Moral responsibility refers to the obligation of the nurse to comply with social laws and standards. Legally, the nurse is accountable for their conduct and actions. Legal responsibilities are duties based on the region's constitution and legal system. The nurse has a moral obligation to refrain from engaging in unlawful or unethical conduct. The conscience of an individual mostly defines moral responsibilities. Personal choice on the scenario. I would have reacted with compassion toward the person who had been injured in the accident. This is because I am aware that the primary responsibility as a nurse is to contribute to the improvement of the general public's health. To offer patient care in a way that is both professional and compassionate is one of the many tasks that I am expected to perform in my capacity as a nurse for the sake of the patient's well-being. Alongside the physician, the nurse serves as the patient's main medical advocate and assists in providing care for the individual. The nurse is accountable for the patient's general health and collaborates with other hospital professionals to deliver the highest quality of clinically feasible care. The nurse is an essential member of the care team and participates in all facets of the care provided to the patient. Conclusion. The ethical principles that nurses must uphold include justice, responsibility, beneficence, autonomy, nonmaleficence, loyalty, and truthfulness. Patients are placed in danger when a nurse performs their profession in an unethical way. In rare instances, a nurse may take advantage of a client by failing to offer the necessary care. Patients have a right to no harm, hence, nonmaleficence demands nurses refrain from causing patient harm. Nurses owe it to themselves, their career, and their clients to uphold the highest standards of ethics. Numerous corporations have ethical boards to examine ethical issues. All practice levels of nurses should participate in the ethical review of their specialized area. Advocating for patient safety, patient rights, and ethical practice considerations is essential.